Okay, so hello everyone. Thank you for your patience. My name is Faiza. I work at Carers Trust Wales. I'm really happy to see lots of people that we work with regularly, but also lots of new faces. So for those of you who are not familiar with Carers Trust Wales, we are part of a national organisation that support unpaid carers. Unpaid carers are people who look after a family member or a friend who has an illness or a disability. We work really closely with our network partners around Wales. Hopefully there's a few on the call. And the network partners offer a range of services and support to local unpaid carers, such as counselling, offering grants, well-being courses, statutory services like respite, all sorts. So we're really pleased that we to work closely with them. The other part of another part of our role is working with local authorities and governments to make sure that we're giving the most accurate and up-to-date information and making sure they're hearing the voice of carers so that decision makers can enact policies, develop programs that really are reaching the um, most vulnerable people, but also the lesser heard communities within that group of unpaid carers. And so, for example, yesterday, I know Simon Hatch, who I don't think he can make it today, our director, and also Llynos Roberts, who is the director of Carers Outreach in North West Wales, the director of Carers Outreach, one of our network partners. They were giving evidence to the Health, Social Care and Sport Committee yesterday, making sure about the impact that COVID has had on carers during the period and how to support them better in the future. And you know, it's really important for us to speak to a range of carers and make sure that their voices are heard by the people who are able to make changes positively for them. So today, oh yeah, by the way, this is our second Lunch and Learn. So I'm running a series of events, which is about tying together what I spoke about influencing government and the hearing carers' voices and bringing that policy and research together. And it is very much an event for all the partners that we work with to be able to connect. So I would urge you during this session to make use of the chat function during the talk, scroll through the names, private message them. You know, it's about making connection. This event is very much for you and working together in lots of different ways to support carers. Today, we're very, very lucky to have Katie Cook with us, who's the project manager for Measuring the Mountain, which is a project funded by Welsh Government looking at how people are experiencing care and support services, care and support. I'm looking at Katie because she'll be like, you're messing up what it is. But you'll have the chance, don't worry. So looking at the impact of the Social Services and Wellbeing Act and how people are experiencing care and support services across Wales, but I'll let Katie explain about that in more detail. In terms of the agenda for this hour, this 50 minutes we have together, I'm going to hand over to Katie, who's going to present for about 20-25 minutes, and I'm sure there'll be lots of kind of questions and ideas emerging from what she's shared with us. And then after that, I'll just open up the kind of floor for discussion, and during that time, feel free to use the chat function. You can use the raise hand function on Teams, and I'll just kind of guide the discussion. But you know, anyway, I'll explain again after Katie's spoken. So without further ado, let's introduce Katie.
Oh. Hello, everybody. big thanks to Pfizer for inviting me here today to talk to all of you. Carers Trust Wales are part of our steering group, and they've been fantastic with supporting and guiding the work of Measuring the Mountain. As Pfizer says, the Measuring the Mountain is looking at the people's experiences of using care and support services or of being an unpaid carer, so that we can find out more about what it's like for people day to day, and so contribute to Welsh Government's evaluation of the early impact of the Social Services and Wellbeing Wales Act. Measuring the Mountain had kind of like two tranches of activity, 2018 into 2019, and then 2019 into 2020. And it's this second bit that I'm going to be talking to you about today. There are two primary elements to Measuring the Mountain. One is story gathering, and then one is a citizens' jury. I'm going to be focusing on the stories today, but just so that you're aware, the citizens' jury took place in September between the 21st and the 25th, and we had 14 members of the public as our jurors. They were randomly selected from the 125 people that registered their interest, and that number kind of really took me aback, actually, because being a juror was not easy. It was an extremely intense week, plus prep, plus some follow-up. So the fact that we had 125 people want to participate was really amazing. Those jurors spent a week listening to information from a range of speakers about kind of delivering, using, accessing, designing services within the care and support sector in Wales. And then they spent a final day drawing up some recommendations. So those sessions were streamed onto YouTube, so they're all available if you're interested in seeing what our jurors heard, hearing their amazing questions and what came out of those. And we will be publishing a report of that activity, including the 16 recommendations that they made, in principle on the 17th of December. I just had an email about that before this began, so that is a pleasing development. So I'm just going to share my screen with you guys now, just for a few minutes, in theory. Oh, yes, that's worked, hasn't it? Good. Right. Oh, no. Right now it's worked, but I can't move my... Oh, no, I'm really sorry. I've messed this up. Hang on. Sorry, guys. I even practiced this, so that's really saying something, isn't it? Right, here we go again.
Don't worry, Katie. It's not being recorded or anything.
No, it's not. It's not like there aren't loads of people on the call listening to this. Okay, so I believe now you can probably see contact details and further information on the screen. I know it normally comes at the end. I'm just getting in there quick. So everything will be published on our website, mtm.wales. You can access our YouTube channel through there. And we will be publishing on the 17th, by the looks of things now, the reports from the citizens' jury, our story gathering report, and also around 400 of the stories that were shared with us. So today we'll give you a bit of a sense of what those stories are like and what you might be able to find out from them. Once those are all published, I'll be sharing the links with Pfizer, and you can also email me and I'll pop you onto my mailing list. So in terms of the stories, I use stories and experiences interchangeably throughout this. We gathered 520 stories from 421 individuals across Wales. You can see from the map their sort of rough distribution, and the height of the bar indicates how many times that postcode prefix was filled in when people were responding to us. Those 520 stories amounted to about 85,000 words, so it's a huge amount of information. We use SenseMaker to gather the stories, and so people were prompted to share an experience with us that stood out to them, and then they answered a series of questions to provide a bit more detail and context, and a bit of information about themselves. So nothing that they shared would have been personally identifiable. Where people did share things in their narrative that was, we have anonymized that, so we've removed those identifying things. And people could choose whether or not we were able to share their story publicly. So just over 100 or so of the stories we won't be sharing publicly, but they have helped inform the analysis. Most of the stories were gathered at groups, events, get-togethers, activities across Wales that somebody from the project, either me or somebody else or somebody from a partner organisation, went along to, and people could share their story verbally with us. A few people went online and shared their stories themselves, and then some people shared them themselves by completing paperwork at an event that we were at. So there was a big element of self-selection. People chose to get involved. They chose what they wanted to share with us. And what we've heard then are very personal stories from that individual's perspective, which I think provides loads of very interesting data. Of the individuals that we spoke to, 193 of them had caring responsibilities, and of those, 105 of them were caring for 100 or more hours a week. So a lot of what I'll talk to you about this morning will have come from those 193 people. But obviously then once we release everything, you can find out lots about lots of other things as well. So just to give you a bit of background about how we kind of have got to where we are now, the stories were coded by members of the steering group. So that's Pfizer, Rachel and Roaya. They read all 85,000 words of narrative, pulled out the themes that were coming through across those stories, and then coded each story against those themes. And we created this sort of framework that you see on the screen. So there are 14 themes, and we've clustered them under the principles of the Act to create a framework for understanding this enormous volume of information that we received. A lot of the experiences could have fit under several of the themes. They're all very interrelated, but what we've tried to do is sort of separate things out so that you can understand what we found out and see what that means in terms of key themes and key trends. The two themes that I'm going to focus on today are about the labour of care and also about valuing carers. So I'm just going to stop sharing my screen now. This is mainly because when I was making the slides, they were just going to be things I was going to read at you, which is extremely boring. So the labour of care came through in lots of the stories, just about how much work it is to support a family member. That we had people describing physically how difficult it can be, mentally how difficult it can be, emotionally how difficult it can be, and in some cases all of those things rolled into one for people. And this was a big theme that I'm sure a lot of you are familiar with, either from your own personal experiences or professional experiences. A lot of the stories that we heard from unpaid carers really highlighted the complexity of the role, and the emotional impact that it can have, as well as sort of some of the physical and psychological components that come with that. And unfortunately, we heard a lot of stories that talked about things like guilt and failure and isolation. Just to be clear, I'm going to share quite a lot of stories this morning that aren't very positive experiences. However, I think they contain a lot of information about what is useful to people, and that I hope will be helpful to you guys. So one of the stories we heard from somebody said, I'm really exhausted. It's a constant battle every day. We've got a routine, which is lucky, but it's never ending, always fighting, getting to my appointments and hers and rearranging. The stigma is terrible. Never thought it would be so bad with friends and family. People drift into the background. You get more and more isolated. And this wasn't uncommon. People talking about that sort of sense of isolation, of being cut off from certain things, and about the shifts that they had experienced in their life since these changes of roles and responsibilities that had happened for them and their family member. Somebody else shared with us, mum was living by herself 18 months ago and then moved in with me. She's 89. She lives in the front room. I put handrails and a toilet and things in downstairs for her. I need to be able to breathe. The mere fact that she's there all the time. She tries to help. If I go anywhere, she wants to come with me. And for a lot of people, I think looking after a loved one, it was that sort of 24-hour, it was ongoing, and in some cases felt quite relentless for people. I will be talking about some more positive things in a little bit, just for anybody who's concerned that this is not a joyous lunchtime that they were hoping it might have been. But I think it really highlights what people are experiencing day to day, and the exhaustion that people feel, and the how difficult it can be day to day for some people. There were a number of stories that talked about a sacrifice in some shape or form. And sometimes this was to do with sort of their own personal, whether it's personal space, like that example just shared, or what they're able to do in their own lives. And in other cases, it was very practical issues like money. So somebody said, our level of support. Changes to funding means she has lost over half of her hours of support. My wife and I are now using our pension pots to help fund her support and top up what has been taken away. And you can absolutely see why people engage in these activities and why they're doing what they're doing. But you can also see how this is potentially quite a short-term solution, and how longer term these people will face additional issues, and that support will need to be put into place to help them through that. And then quite a lot of people talked about mental health issues that they had been experiencing. Now, this happened across the stories. We had over 70 stories specifically related to mental health problems that people were having. And they were associated with all manner of different services and settings, and they came from both unpaid carers and people who were making use of services. But this one, for example, she says, I'm on meds for depression and anxiety, been running on empty. You can do it for so long and then you collapse. I do everything. It's not just about caring and then going home. I can't just up and go. I have to consider him. I wouldn't have it any other way, but you have to consider it. I can't leave him for more than a few hours. And this was something that certainly I noticed when I was talking to people and they were sharing stories with me, that one of our questions was, how many hours a week on average do you spend caring for somebody? And somebody's response might be, say, 20 hours a week. But then in discussion with them, you can see actually how many more hours are clearly devoted to thinking about that person. So whilst practically and physically they might just be there for 20 hours, outside of that, it's a dominating thought and always at the back of their head in some way. But this thing of I wouldn't have it any other way, this came through in lots and lots of the stories, that this is why people care for their loved one, because they love them. And that then sort of makes all of this other sacrifice worthwhile. And whilst they wouldn't, ideally they maybe wouldn't want to be in this situation, now that they are, this is what they're doing, and they're gonna make it work. Somebody shared with us, I need to find a job that doesn't kill me. I want to work nights so I have the days free to help mum. I did a 7-hour shift and it knocked me back. I had an accident in 2018 and was really struggling. I need to find a job that doesn't fatigue or hurt me. I do a lot of yoga and would like to go to the gym, but I can't afford it. Carer's allowance isn't enough. I need more money to pay rent and for my children. And so this chap's experience, I think, really highlights that complexity a lot of people are experiencing day to day. We had a lot of examples from people where they had a health condition. They were also caring for a family member who had a health condition. In some cases, people were kind of caring for one another in a sort of almost take it in turns kind of way. I met a woman at an event. Her and her daughter both had quite profound health needs, but they both had fluctuating conditions. So they sort of relied on the hope that their conditions would sort of fluctuate in opposite directions, so that at any given time, one of them would be well, should the other one need other support. And sometimes that worked, and then sometimes it didn't, and people would end up being hospitalized. So there are a lot of examples of within a family, multiple health conditions, people caring for one another, plus then juggling all of that other stuff that comes with, like, being alive and living with other people, and things like finance and raising children and work were ongoing themes that cropped up in stories for people. But throughout all of that was this sense of, I love them, I want them to be as well as they possibly can be, and to have the best quality of life that they can. Something that came through in the stories as being really positive was when services found ways to make themselves available in manners that suited those individuals, and fit in with their life and all of the things that they were trying to sort out. So a number of people described issues around trying to know what was available to them, find information, find services, but actually you need to know what you're looking for, and then you need to have the time and the headspace to do that and filter through everything that you find out there, which is really difficult. So where services could cut out some of that for people and make themselves known and offer things, that came through as very helpful to a lot of people. Somebody shared, I went to the GP with my mum and saw the Carers Centre banner. I wasn't going to do anything about it, but this was on one of mum's good days. She asked about the banner and was told someone from the organisation was there if we wanted to talk. I felt that this was going to be another false promise. I was too scared to hope. But when we went into the room, I recognised the lady, and it was good, as she's the person who runs the project. I would then end up accessing. There was support there if I needed it, and it was a chance for respite and to take my mind off things. So that being available, offering support, and then also that continuity was really helpful, kind of seeing the same person at the GPs and then also at the service. Then when she started accessing it was really helpful. And that was something that came through a lot in the stories that we heard about community groups and activities. So we had something about 120 odd stories about community activities and groups. Mostly they were really, really positive. And a big thing that came through from them was people creating networks, that sense of community, of having people to spend time with, talk to, not talk to, just have a cup of tea near them. And for a lot of people, knowing that others were experiencing similar things was really helpful as well. And those groups were a real mix. So some of them had been started up by just a person who went, this is the sort of support I would find helpful, so I'm going to make it. Others were run by the local authority, others by third sector, sometimes a mix of them. Sometimes they were run by third sector, but a community connector from the local authority had come along. But in almost all cases, they were seen as a really useful source of information, of reassurance, and of kind of creating a more social element to things in a nice environment that people were happy to be in and engage in. And that sharing of information was happening from, if there was a community connector there, they would be sharing information, but also a lot of people were sharing information just amongst themselves, just by way of having a conversation and things cropping up. The final thing that I want to now, and I'm aware that this is something of a whistle-stop tour of some of what we found out, but hopefully it will, you'll see some of what's out there, so that then when we do publish, you'll be able to go and have a read through all of it yourselves. But the last thing I just wanted to talk about a bit was the role of unpaid carers in working with professionals to support their loved one. So we had a number of stories where carers described being ignored or sidelined by professionals. So professionals were seeking to support the individual, but then just ignoring what the unpaid carer was wanting to contribute to the discussion. And this was a source of frustration, anger, upset, and often associated with less good outcomes for the person being supported as well. So somebody shared, I care for my mum. She has multiple sclerosis. She was sent to the hospital and treated for constipation. We knew that there was more to it than just constipation. We asked for additional tests. This was ignored. My point is, we knew our mum better than they did. We knew when she was well compared to when she was ill. They should have paid more attention to our concerns. And somebody else said, I contacted social services to say we couldn't keep him safe and that we needed help. We were offered a few hours a week. We didn't know what to do. He has violent outbursts. Because we didn't fit the criteria, he didn't have a social worker, and that made getting any other support really difficult. Some professionals know that you know your son, others view you as difficult. You feel like you're being a pain. And these kind of sentiments came through in quite a lot of stories where people felt that they were kind of being a burden or being difficult by trying to raise things that they knew to be really important. I recognize that every situation is different and every interaction with others is going to be different. And our work has been specifically around engaging with individuals using services and unpaid care. But it was noticeable to which people being ignored had a really detrimental effect on their experience overall. And then in contrast, when people are listened to and engaged with, and people using services, their carer and any professionals involved all working together as a team, unsurprisingly, those were generally very positive stories. So somebody shared, I care for my son who has schizophrenia. His community psychiatric nurse comes to the house every fortnight to give him his injection. She's an amazing lady. He's got a lot of confidence in her. She's like a friend, and I get to have a quick chat with her when she comes. I so appreciate that. The input from carers like me is so important. He can be secretive, but the CPN always listens to what I have to say, and I'm with him all the time, so I see things. He can lead quite a good life now. You can tell from his face, no more haunted looks. And then somebody else shared, my dad lives in a care home just down the road. He's got a section on his door about his needs, uses, likes. They support him to be independent and everything is tailored to him. The staff will know him well. Staff are assigned to sections, so he sees the same people all the time. It's like a little family down there. It's really friendly. We all work together. If he wants to watch the rugby, he'll tell me. I'll tell his nurse, and then we'll arrange for someone to go with him if we can't, and I'll get the tickets. So these were some really positive examples of everybody kind of working together, and that sense of like working with rather than to. So yeah, so those were just a few things that I kind of wanted to flag. The labour that goes into caring for somebody, the opportunities to offer information fit in with what would work for those individuals, and kind of viewing unpaid carers as really knowledgeable, valuable sources of information, and the usefulness in everybody kind of working together and the positive outcomes that that seems to lead to for people. So yeah, thank you very much. And I think Faiza's going to kind of hand over for questions and things now.
Thank you, Katie. That was really, really interesting. And I just think it's incredible, the information and stories that you've gathered from people is really incredible, but also the way that you've done it. I really personally think it's an incredible and unique kind of project where you've gone out to all parts of Wales, literally just saying to people, tell me your story, and collecting that in their own words. I think there's something really valuable about the kind of the methodology there as well. So we've got we've got a good 25 minutes for discussion, and I'm really happy for this to be shaped by everyone attending. So either you've got the opportunity to ask Katie any questions, but otherwise what I was really interested in was whether, or what I think might be valuable for other people is, number one, whether what Katie has spoken about, some of the stories that she shared, whether they're familiar to you. Is it something that's kind of resonating with you in, you know, whatever professional capacity you work in, or as a carer yourself? And I suppose the other thing is about how you are in your role supporting carers to have those positive experiences. What are you doing to make some of those shining examples come out, whether that is in how you're interacting with them on that one-to-one basis, or on a larger scale with collaborating with other local organizations? So, and obviously I know that Rawaya is on the call, who had a role in really delving deep into the story. So she's very welcome to kind of speak up if she would like as well. I don't want to put her on the spot though. Does anyone want to kick off? You can use the hand function or say your comments in the chat, like I said. Don't make this awkward for me. That's just not nice, is it?
If it's useful, do you want me to? Oh,
Oh, there's Rachel. Rachel, go ahead. Thank you.
Afternoon. Can you hear me okay?
Yeah.
Brilliant. Thanks, Katie. I think it's fascinating research, and I think it's hugely important, and it's really timely. I kind of feel at the moment like we've got a bit of an opportunity with government. You know, the COVID's kind of meant that all the chips have been thrown up in the air, and I think there's an opportunity for us to kind of intervene as the chips land again. And so I work for Oxfam, and we've been doing quite a lot of work right around the world looking at the value of care. So not just unpaid carers, but paid carers and child carers and the rest of it. And I'm just wondering, so in our conversations with government, if there's kind of one message about how, you know, the one message that you would want like Welsh government to hear about what they can do to better value carers, like what would that look like? You know, so there's kind of lots of little things, you know, increasing carers allowance and pay in the social care sector and that kind of thing. But I just wonder, as a whole, what it is from your research that we should be telling Welsh Government about how we should be better valuing carers.
Oh, wow. This was quite the opener. Right, that is...
You can think about it and come back to me on it if you want, but it would be a big help.
Okay, yeah, I can say... yes, because I definitely think there's something really important about recognizing what carers are doing just in every way, personally, community-wise, economically. There's so much that hundreds of thousands of people across Wales are contributing every day, and I feel like sometimes that gets... you know, I've seen stuff that has come out during the pandemic and stuff where I felt a bit like, ooh, that sounds like a bit of an add-on, or like you haven't really thought about this. Like, and I read something a while ago about, you know, people didn't need to worry about the Coronavirus Act long term because everybody understood that your capacity to cope in a crisis wasn't reflective of your capacity to cope overall, or something to that effect. And I kind of thought, do you know what? I've spoken to a lot of people who basically are in crisis every day, but you can't be in crisis every day, so it can't be described as that, but that basically is what it is. So I think just something very clear about recognizing in every way what unpaid carers are contributing. But I will give this with something more articulate and less rambly.
Yeah, and it was really interesting, that report by the Track the Act by Carers Wales, which, what was the figure they came to? That £33 billion a week is saved for Welsh Government from the work that carers are doing. But it might be helpful, Katie, to direct Rachel to the Citizens Jury report, do you think? Because that's exactly that was a week-long session where they were hearing evidence from all sorts of organizations, and they worked really hard to come up with those recommendations. And I don't know who it was last week, but that said these are the best recommendations that I've ever read. They're like realistic, you know, meeting all the SMART targets, and really intuitive. I don't know if you want to add to that, Katie.
No, but I will be sending out the links to all of these reports with a bit of blurb about all of them. So between Pfizer and I, that should get out to all of you in the next 8 days.
I thought you were going to say 8 minutes. Did you want to come back, Rachel, or say anything more?
No, but yes, please, I will have those reports. Thank you.
Great.
Great. I know one of the steering group members for Measuring the Mountain, Vin, has got his hand up. So did you want to come in, Vin, and then I'll go to Rowena next?
Yeah. I was going to suggest that Katie actually referred to the Citizens Jury, because that was a very intense week of work to finish off the massive mountain of work that Katie and Rachel and others did in bringing all these stories together, and not only bringing stories together which weren't directed by anybody, they were people's stories as they wanted to tell them, and then going through all that and pulling it out and making the sort of sense that Katie's done in the last half hour, which is just a mind-boggling piece of work. I don't see any differentiation between policies that Welsh Government can improve to support disabled people and policies that Welsh Government can improve to support carers. And I won't use the term unpaid carers. because, as I said in the chat, the 2014 Act defined a carer as somebody who is unpaid and is providing support. So I'm lobbying for people to stop referring to paid staff as carers entirely, because a carer is an unpaid support person. So if Welsh Government, if local government particularly, when it gets back to being funded properly by the UK Government or Welsh Government or whoever, so that we can have a civilised public sector, if their policies support disabled people, then huge levels of strain are taken off carers, because they don't have to constantly to upgrade the support that people are getting. There's an element of disability discrimination going on here. We have institutionalised disablism, just in the same way that the Met had institutionalised racism across the public sector. Disabled people are not considered as equal to non-disabled people, which is why they tend to be at the end of a long list of priorities when funding is agreed. So the support workers, personal assistants, support workers of any sort, are paid a terrible wage. They're really paid peanuts. So people like my wife and I, who are unpaid carers for our 37-year-old daughter, when we try to help her employ personal assistants using her direct payments, it's a real struggle because, sorry about that, it's a real struggle because the level of wages that we can offer are a pittance, and we're asking people to do a wide range to employ a wide range of skill sets, and to be really committed and dedicated to what they're doing, and to be supportive towards our daughter, in a sense to be supportive towards us as carers as well. And at the end of the week, it's really embarrassing the amount of money that we're able to pay them, and we don't have any income ourselves to be able to top that up. So I mean, there's been lots of talk in Welsh Government about recognising the skills. Stop referring to support workers as unskilled. They absolutely are not unskilled, and to pay them a commensurate wage, to put training in place so that they can have a career path. If that is sorted out, then a huge amount of burden is shifted away from carers. Thank you.
Thank you, Vin. You're always a wealth of knowledge, and I always learn something new every time you share, so thank you. Rowena, do you want to come in? Do you want to introduce yourself as well, so that everyone's...
Hi, I'm a social worker. I work in adult services in a team that's called the Community Initial Assessment Team in Swansea. We deal with people who are at crisis in the first sort of 6 weeks of involvement at the moment, and I'm their carers champion, for, as well as being a carer for a parent carer for a 20-year-old and another child who's going through diagnosis at the moment. My point was, maybe this isn't the place, but it was something I sort of wanted to put forward because of the pandemic, because of the increased recognition of carers and the role we play in our loved ones' lives. Is the possibility of having a tax allowance. I know that might sound a bit strange, but it would be a recognition of our role in the way you can have a married person's allowance. And I know this isn't a Welsh Government gift that can be given, it's only from the national government. But it would be a very clear way of saying, carers, you are doing a job on behalf of society to help, and as I say, it won't affect people in the same way on benefit, but I think it's something that could galvanise a lot of support at the moment, because it doesn't come from local government services, which are incredibly stretched, as I'm sure you're all very aware in the pandemic. And yet it would be a way of, for everyone, of seeing the role we play. Does that make sense?
Yeah, that makes complete sense. And I suppose it's a good time to remind everyone that, there is a consultation open for the National Plan for Carers that anyone is able to respond to. So I would really urge everyone and anyone who's able to make those points known in written form to Welsh Government for this consultation. And I think it seems like there's this theme of value coming out repeatedly on what everyone's saying. It feels like there's this bubble of emotion of not being recognized and valued for what you're doing, because carers are going to do what they're doing because they're supporting their family member or their friend. That's going to happen, and all they're asking for, and not even in return, they're asking for rights that are already written down in legislation to be able to access those. But I was just going to ask, Rowena, it was really interesting because you said that you work in social care as a social worker and you're a carer. And I just wondered if, not to put you on the spot, but if you had any kind of reflections on, do you have different points of view? You've got a really unique perspective of, in your personal life, having to face challenges, but also being on the kind of provision end. Do you dwell on that much?
Yes. I think it has helped. It helps me on a personal level because I think I am better able to empathise with people that I work with, because I know a little bit of what they're going through, although it's different for everyone. My child was born with difficulties, one of them, and I've had to battle like the same as everyone else. I've had to battle with education. I've had to battle with social services in the past, myself. So it does give me a different perspective, but I wouldn't say it's unique. A very large proportion of the team in which I work also have caring responsibilities, sometimes for their parents, for disabled children adult disabled children as well. So actually there's a lot of social workers who also take on the role of being a carer outside work. I do think it helps me. I won't be too critical of Swansea here, but I have also had my battles within the service. One of the things was we used to be entitled to paid leave to attend appointments with our loved one, hospital appointments, etc. And that was withdrawn a few years ago, and now we have to take a unpaid leave to attend appointments and things like that, which was a huge blow to someone like me who used to spend half my life attending various hospital appointments. So there are good things that Swansea recognise, and I do think having carers champions within teams is helpful. I'm not a great font of knowledge, but I'm a voice saying, have we thought about the carer here?
Yeah.
But I do feel most of my colleagues are acutely aware of how hard this is on carers. This pandemic, without the support of carers, would have led to a collapse in our system. I truly believe that. The only way we have managed to carry on is because not only have carers continued to provide care, they have massively increased the amount of support they provide because of the limited support that we have available, because of the difficulties in accessing support. The COVID measures allow us to prioritise those at greatest need. So the priority is we can only provide support if someone is at risk of death or hospital admission or care home. That's it. Anything less than that, we don't provide support, at least within Swansea. And in adult services, sorry, I wouldn't know the criteria within child services. But that is what we're working under. So all those people that qualified for assessment and support previously would no longer meet that criteria. So it is carers that are keeping social services going.
Yeah, thank you, Rowena, for kind of sharing your thoughts. And I think I'm always one to try and pull out positives. And one thing that you did say was that you're not, as a social worker, you're not a font of knowledge, but you do always ask, what would the carer value this? I can't remember exactly how you termed it. And I think there's something really there, because in these discussions, we should and can be talking about the big picture stuff, but I think there's definitely something there that, especially that came out, I think, I don't know if you'd agree, Katie, in the stories, was that personal touch and personal interaction can make a huge amount of difference. We know that a carer won't be able necessarily to have exactly what they need in the shape and way that they want, but if that communication and that understanding and transparency and empathy is displayed, that can go a long way. I know, Mariah, you had your hand up and you played a really big role in kind of analysing the stories. Did you still want to come in, or have you had to leave? She might have been called away. Okay, so I am gonna. Katie, did you want to say anything before I go to Kathy in Bridgend? No? Okay, go ahead, Kathy. Hello.
Hello. I'm good, thanks. Yeah. I want to apologise in advance. My daughter's home from school today. Her heating has broken down. So if you hear any chirping, screeching, or I get bitten, just ignore it. I work as a lead officer for carers in Bridgend County Borough Council, so things like commissioning and how we undertake assessments sit with me. But I also have a caring responsibility. I've got two profoundly disabled young people. My son is 21, my daughter is 17. For social services to put in replacement care for me to have a break, it requires 5 staff members because of the complexity and the challenges. I just really wanted to say that it's really difficult, I think. I had a meeting nationally with my colleagues that do my job yesterday, and we felt quite positive that we'd put in the support that we could put in, and we were trying our best to put in the support that we could during the pandemic. And so to hear some of this, I suppose, is a little bit, it just feels a bit disappointing, you know, and these are people's lived experiences and obviously must be taken seriously. And also on a personal note, I felt really supported throughout the pandemic. I work in Bridgend, but I live in Neath Talbot. And for us, we've had constant communication from services, offers of support, even though the main services like day centres, etc., have been closed. We've had no short breaks. However, we haven't felt abandoned and have felt valued during the pandemic, which seems to be a unique experience, I think, from hearing some of the things you say. And I, again, like Rowena, I've had my battles with the local authority, God knows, over the 21 years. But I just think it's felt good. Not good maybe, because it's been blinking exhausting, but it's felt good to be understood and valued and remembered. So I just sort of wanted to put that in, really, just to say that it hasn't all been negative for us.
I think, can I just come in on just to say that I definitely should have said when I was speaking. The stories that we gathered were gathered from 1st of August last year through to end of May this year. And from March 20th, so from early March, so when we kind of went into lockdown and stuff, we gathered very few stories after that point, because so many of ours came from going to groups and talking to people. So we none really of what I shared today stemmed from us being in the pandemic, although I am aware of other pieces of work that have been going on to collate some of that in people's experiences. And also I think people's experiences have been really mixed. You know, within the project we heard really great things from people and then really not good things from people. Something I would say in relation to what Pfizer was saying is that yes, that kind of personal relationships that people have are super important, and they did quite often make a huge amount of difference. So we would have people share really good things with us and then say, oh, but I don't know if it would have been like that if it hadn't been for Janet or whoever it was. And there is I think there's a real individualness to what people's experiences have been like and the specific factors that have led to that.
Excellent. Thank you, Katie. We're kind of coming up to the end of the session now. Did you want to say, I did want to ask you, Katie, before we kind of wrap up, about kind of what next? Is there anything people can do to kind of take the baton from Measuring the Mountain, which is ending at the end of this year, isn't it? Is there any way, what do you have a message for everyone on the call?
Well, so once we've published everything, I will be sharing that information as far and as wide as I can in my remaining 24 hours working on the project once we've published them. But so I would really just encourage people to go and look at what we've found out. Go and look at our reports. Go and look at the 400 and odd stories that we'll be releasing. There was a question in the comments about would we have a breakdown by area. What I'm going to do is release a database of stories with a small amount of the monitoring information next to them, nothing that would make people identifiable. But I think we're likely to group the stories by regional partnership board area, something like that. So you'll get a bit of a sense of where they've come from. But it is worth keeping in mind that the numbers that we've collected and the way that we collected them. So as somebody has said in the comments and as has come up before, when you ask people to share something with you and something that stands out for them, if they've recently had a negative experience, it may be that stands out for them. Equally, if they've just had a really great experience, that will also stand out for them. And we did have people who shared not so great things and then go, oh, wait, no, hang on, I'm going to tell you a good thing as well. So just keep all of that in mind when you're looking at what we're sharing. But I would say to you, if what you read from our reports and from our stories resonates with you, then there's definitely things to learn, there's things to think about and mull over. So I would say, yeah, just go and take a look at what we found out, and if it's helpful to you, please make as much use of it as you can and spread the word that it's there, because also the videos from the jury are great. There's some really, really good sessions in there and loads of really, really good information. So I just encourage you to make as much use of it as you can.
Thank you so much, Katie, and to everyone for contributing.